Well, with New Year's resolutions still fresh on our minds, it is so critical to keep your oral health on the top of your A list. Richmond dentist Marcy Guthrie is back with us in studio with some helpful tips and advice to keep that teeth in great shape. Wonderful to see you again, doctor. It's a pleasure. All right, so a lot of people making those resolutions, and we need to take care of our choppers.
Yes.
Where do we begin, though, Marcy?
Well, first, I think I have 6 resolutions I'd like to share for Channel 6. First, I think we should tweak your technique. So a lot of people, flossing is an issue, but if we can try to floss first, I think that maybe help getting the flossing done and then brushing afterwards. And I recommend the Sonicare toothbrush. It has a 2-minute timer. If you don't have a Sonicare, there's a timer you can get maybe from your dentist.
So you need to do that for 2 minutes?
2 minutes, twice a day.
Twice a day.
And then to check if you're doing a good job, your gums should not bleed. So healthy gums don't bleed, and that should be the cell sign.
What's that a sign of? If,
gingivitis.
Gingivitis.
Gum disease.
Preventable and treatable?
Treatable,
Okay.
yes. Yes, with everybody's different for how that should be treated, but yeah.
Doctor, you were saying that a lot of people do floss, a lot of people don't, but for the folks that are flossing, do people do it incorrectly?
Some people do it incorrectly, correct. So if you don't like the floss, which your dentist can help you with a proper technique, I'd like to offer my patients to try these soft picks, or to get
soft picks?
Soft picks that go in between your teeth. Are great for kids with braces because they're hard to keep clean, and retainers if you have them, or get a water pick. A water pick is a good alternative to flossing.
Okay, do we have to change our food habits as well?
Yes, I think that number 2 is rethink your drink. So
oh, I like that. Rethink the drink.
Rethink the drink.
All right, so you brought
sugars.
in some empty bottles here. What are some of the culprits that should be eliminated from our diet, or at least maybe in moderation?
In moderation is key. The Mountain Dew, the Coke, the Dr. Peppers, they're up in the 60 grams of sugar here that I have weighted out.
60?
60. And so all of these are 20 to 60. Apple juices for kids is commonly given. So you have to rethink the frequency, the amount of time that they are sipping on drinks, because it creates an environment for cavities. And I added the diet drinks there because a lot of people think that they're doing well with diet without the sugar, but there's still a high acid content there. So all of these are lower than a pH of 5.5. And 5.5 is where enamel, the tooth structure, starts to demineralize and erode and create the environment for cavities. So water is the best.
There are no granules of sugar in that at all.
Right.
What other tips do you recommend?
So number 3 for me is face your fears. A lot of people don't seek the dentist out of fear for past bad experiences. And you know, a lot of cavities these days go without symptoms. So just because everything feels okay doesn't mean that it is. So if your dentist recommended treatment, I say get it done. Prevention is key, and waiting is more costly, mostly financially and emotionally, when you have to eventually possibly lose a tooth.
Indeed. We have got about 20 seconds right here. Let's run through those last 3 right there.
Okay, kick the habit, no smoking,
Done.
quit the smoking, and if you have a craving, choose something xylitol. Dr. John sells xylitol on Amazon. Wear your night guard. If you have a night guard, get it out of the nightstand and wear it. And if you think you're clenching or grinding, talk to your dentist about it and get a night guard to prevent wear.
And last but not least,
schedule an appointment. Find a dentist that you trust.
Go see the dentist. They're not bad, right?
Correct.
All right. Hey, listen, Dr. Marcy Guthrie is the chairwoman of the local Give Kids a Smile campaign, and they are holding an event Friday, February 3rd at the Aka Shriners Temple, where they treat children in the city that get transported from the event from their schools. For more information, we're going to post a link right on our website, WTVR.com/VTM. Dr. Guthrie, it's always a pleasure. Nice to see you. I feel better already. We'll be right back.